I've seen it reported, repeatedly, and I would say, it's a trend. It's not a good trend. I guess I'd tee it up by saying it's not a good trend because fundamental to chronic disease management is behavior change. And if a patient who has no symptoms of their chronic disease is going to do the right thing, they need to make a leap of faith that what whoever is telling them to do is the right thing, even though it's almost not human nature, right? To do something different when you have no, like you're smoking, but you don't have cancer, or you're an uncontrolled hypertensive or diabetic, but you feel fine. Why? Like there's something biological that we're fighting against in human nature. So erosion of trust in the industry overall, and specifically in the providers, both, I would say this is probably true of nurses too. Nurses have a key role, is really dangerous, literally dangerous. And it is in some ways, I think, a response to um, the larger the larger questioning of scientific validity that's occurring. It's also, I think, sort of a transference of people's frustration with healthcare, the industry overall. People might have real financial uh, stress because of their healthcare condition. That translates to their provider. Maybe, probably not intentionally. And then the other thing is, gosh, the whole thing has just become scientifically, clinically, it's become so much more complicated. So I, as a general internist, I mean, my grandfather was a general internist. He had, 5 drugs to treat hypertension. Now there's 50. Um, and you add to that all the new diseases that we've identified, which is all progress, but it creates a much more complicated system. And that creates, from a patient's perspective, situations where their provider doesn't seem to know them as well as they should, or know their condition as well as they should. Um, at the same time, I mean, well, yeah. And the fourth thing I was going to raise was providers themselves are really, the effects of COVID on the provider community are going to be long lasting. And so I think I don't think it's triggering the lack of trust, as I think of the cast of characters, the providers are in a rough space too.